While you were sleeping last night, your prostate may have been getting worse. Not a little worse, measurably, progressively, silently worse. And the terrifying part is that most men have no idea it's happening because the damage happens in the dark, while you're horizontal, while your body is supposed to be recovering. If you've been waking up 2, 3, maybe 4 times a night to use the bathroom, if you lie back down and can't fall asleep right away, if you wake up exhausted even after 8 hours in bed, those aren't just inconveniences, those are warning signals. Your body is trying to tell you something specific, and tonight, right now, you are going to learn exactly what it's saying. Here's the question that matters most. What is actually happening to your prostate while you sleep, and is there something you can do about it starting tonight before you even close your eyes again? Because the answer is yes. There are 5 very specific signs that your prostate is deteriorating during the night hours, and each one of them has a direct, practical response you can start applying immediately. But first, you need to know what you're looking for. Most men over 60 accept nighttime disruption as normal. They chalk it up to aging. They assume their body is just changing and there's nothing to be done. That mindset is dangerous. It's not just wrong, it's actively keeping men from taking steps that could change their sleep, their energy, their quality of life, and possibly the long-term trajectory of their prostate health. Accepting these signs as inevitable is one of the biggest mistakes a man over 60 can make. I'm Dr. Natalie Parker, and if you want to keep receiving important content about men's health after 60, subscribe to the channel and hit the bell. Now, let's get into this immediately, because these 5 signs are more serious than most men realize, and understanding them is the first step toward actually doing something about them tonight. The first sign is something almost every man over 60 has experienced, but very few have connected to prostate deterioration specifically. It's the number of times you wake up to urinate. The medical term is nocturia. And while most men think 1 or 2 nighttime trips is just normal aging, the reality is more nuanced and more alarming. 1 trip per night can be acceptable depending on hydration habits and timing of fluid intake. But 2 or more trips consistently, night after night, is a clinical signal that something is wrong. It tells your doctor that your bladder is not storing urine properly through the night, that your prostate may be creating resistance in your urinary tract, or that both of those things are happening at the same time. Here's why this matters so much. Every time you wake up, your body is pulled out of deep sleep. Not just light sleep. Deep, restorative, hormonally active sleep. During deep sleep, your body produces human growth hormone, repairs tissue, consolidates memory, regulates immune function, and most importantly for your prostate, it produces anti-inflammatory signals that help calm the very tissue that's causing the problem. When you interrupt that cycle 2, 3, 4 times a night, you're not just losing sleep. You're preventing your body from doing the repair work it needs to do. You are actively interfering with your own healing. And the next day you wake up inflamed, foggy, and your prostate has had 1 more night without proper recovery. The cycle compounds. Night after night, month after month, the inflammation that drives prostate enlargement gets a little worse, and the sleep disruption gets a little more frequent. Men who notice they've gone from 1 nighttime trip to 2, and then from 2 to 3 over the course of a year, are often watching prostate progression happen in real time without knowing it. Do not ignore the trend. If your nighttime trips are increasing, that trajectory needs to stop. So what can you do about this specific sign starting tonight? The answer begins hours before you get into bed. Your fluid cutoff matters enormously. Most urologists recommend stopping significant fluid intake approximately 2 hours before bed. That doesn't mean you become dehydrated. It means you front-load your hydration. Drink the majority of your water in the morning and early afternoon, taper in the late afternoon, and minimize in the evening. If you tend to reach for a glass of water right before bed out of habit, try replacing that habit with a small amount, just a few sips. Your bladder will thank you. But be careful here because dehydration concentrates your urine, and concentrated urine is a bladder irritant on its own, so the goal is balance, not elimination. The second sign is one that many men notice but rarely talk about. It's incomplete emptying. You go to the bathroom in the middle of the night, you urinate, and you go back to bed. But within 20 or 30 minutes, you feel the urge again. You get up a second time and barely anything comes out. That sensation, the feeling that your bladder never truly empties, is called post-void residual, and it's a direct consequence of your prostate putting pressure on your urethra. Think about squeezing a tube of toothpaste from the middle instead of the bottom. You're pushing, but you're only getting part of what's in there. The rest gets stuck. That's what's happening in your bladder when your prostate is enlarged and pressing on the outflow tract. The practical consequence at night is that your bladder is never actually empty. Even after you urinate, there's residual urine sitting in there. That residual triggers the sensation of fullness again very quickly. So you're waking up not because your kidneys produced more urine, but because the urine that was already there never fully left. This is a sign of significant prostate pressure on the urethra, and over time, residual urine that sits in the bladder can become a risk for urinary tract infections, bladder stones, and in serious cases, kidney back pressure. It is not something to wait on. If you consistently feel like you haven't fully emptied after urinating, that specific symptom needs to be discussed with a urologist. There are behavioral techniques, positional adjustments, and in some cases medical interventions that can meaningfully improve this. Don't accept it as permanent. The third sign is one that most men never connect to their prostate at all. It's sleep quality without the trips. In other words, even on the nights where you only get up once or twice, you still wake up feeling exhausted, unrefreshed, like the sleep didn't do anything. Here's what's actually happening. Prostate problems don't just disrupt your sleep through bathroom trips. They create a background state of physiological stress that suppresses deep sleep architecture even when you're lying still. Chronic inflammation, which is almost always present in men with significant prostate enlargement, activates stress pathways in the body that keep your nervous system slightly elevated. Your cortisol regulation shifts, your melatonin production can be suppressed. Your body stays in a lighter, more alert sleep stage for a greater proportion of the night. You don't get enough slow-wave sleep, and you don't get enough REM sleep. Both of those are where physical and cognitive restoration happen. The result is that even a full night in bed leaves you feeling depleted. If you wake up tired despite having slept a reasonable number of hours, and if that's been your pattern for months or years, it is worth asking whether your prostate inflammation is contributing to that chronic fatigue. This is not a theoretical connection. Research on sleep architecture in men with lower urinary tract symptoms consistently shows reduced deep sleep duration compared to men without those symptoms. Your prostate is affecting your rest even when your bladder isn't waking you up. What helps this sign specifically? Reducing systemic inflammation through diet is one of the most powerful levers you have. Cutting added sugars, processed foods, and alcohol, especially in the evening, lowers the inflammatory baseline that your body is operating from. When inflammation decreases, the stress signals that suppress deep sleep begin to quiet down. Many men report that within 2 to 3 weeks of making targeted dietary changes, their sleep quality improves noticeably even before their urinary frequency fully normalizes. The body feels safer, the nervous system calms, and deep sleep returns. Now we need to talk about something very important for men in your position, because the signs we're discussing don't exist in isolation. They are part of a pattern that affects your health at multiple levels simultaneously. Before I continue with signs 4 and 5, I want to make sure you have access to a complete resource that takes everything we're discussing and puts it into a structured, actionable format you can actually follow. The Medical Guide to Avoid the Mistakes That Damage the Prostate. After 60, available in the pinned comment below the video. This guide goes beyond general advice. It includes specific food lists, evening routine protocols, hydration strategies timed around sleep, and the key questions to ask your doctor if your symptoms are progressing. It was designed specifically for men who want to take this seriously and not just watch a video, but actually change their outcomes. You'll find it in the pinned comment right now. Take a moment to grab it before continuing, because what I'm about to share in the last 2 signs is where things get most critical. The 4th sign is something that happens in the early morning hours between about 3 and 6 a.m., and it's more specific than just needing to urinate. It's a combination of urgency, weak flow, and a burning or pressure sensation during urination. This combination, when it occurs specifically in those early morning hours, often indicates that your prostate is at its most inflamed point in the daily cycle. Here's why that window matters. Cortisol, your body's primary anti-inflammatory hormone, is at its lowest point in the early morning hours, just before it begins rising toward its natural morning peak. That means the body's natural anti-inflammatory protection is at its weakest precisely during those hours. If your prostate carries significant chronic inflammation, the early morning is when that inflammation is least controlled. The tissue is at its most swollen, the pressure on the urethra is at its highest. And if you add to that the fact that the bladder has been filling all night with no release, you get a perfect storm. Maximum bladder pressure plus maximum prostate swelling plus minimum anti-inflammatory protection. That is why some men describe their worst urinary symptoms occurring between 3 and 5 in the morning. That specific timing is not random. It is your body showing you exactly where the inflammatory problem lives. If you are consistently experiencing your worst symptoms in that window, you are dealing with significant underlying prostate inflammation that is responding to hormonal rhythms. This matters enormously for treatment and management strategy. A urologist who understands this pattern can use it to guide therapy decisions much more precisely than one who is only looking at general symptom frequency. What can you do about this? Evening dietary choices play a massive role. Anything that increases systemic inflammation, meaning processed foods, alcohol, high sugar intake, or heavy meals eaten late, will amplify this early morning inflammatory peak. Conversely, an anti-inflammatory dinner, lean protein, vegetables, olive oil, a small handful of walnuts eaten at a reasonable hour helps set your body up for a less inflammatory overnight cycle. Temperature also plays a role. Cold exposure during those early morning hours can worsen symptoms. If you're someone who gets up at 4 a.m., in a cold house, keeping yourself warm during that trip to the bathroom matters more than you might think. Blood flow to the prostate is temperature sensitive, and cold constriction can intensify the symptoms briefly. Small adjustments like keeping a robe or slippers nearby can make a meaningful difference in how intense that early morning experience feels. The fifth sign is the one that brings everything together, and it's also the one that should motivate the most urgent action. It's the progression pattern itself, not any single symptom, but the direction your symptoms are moving over time. If 6 months ago you were waking up once a night and now you're waking up 3 times, that is progression. If a year ago your flow was weak but manageable and now you are noticing significant hesitation or straining to start urination, that is progression. If you have started changing your behavior in ways you wouldn't have before, avoiding long car trips because you're unsure about access to a bathroom, waking up preemptively before bed to empty your bladder just in case, cutting off fluids aggressively because you're afraid of what will happen if you don't, that behavioral adaptation is itself a symptom. It means your prostate is already limiting your life. Men who recognize this pattern early, who understand that the direction of change matters as much as the current severity, are the men who take action before their options narrow, because prostate health exists on a spectrum. At one end is mild, manageable enlargement with minimal symptoms. At the other end is significant obstruction requiring intervention. Where you land on that spectrum 5 years from now depends enormously on the choices you make starting tonight. Here is what the evidence shows about the factors that accelerate progression. Chronic sleep deprivation itself is one of them. When you are consistently sleep deprived, your body increases inflammatory cytokine production, which means the disrupted sleep caused by prostate symptoms then worsens the inflammation that caused those symptoms in the first place. Sleep deprivation elevates cortisol chronically, disrupts testosterone production, and promotes the kind of metabolic dysfunction that actively drives prostate enlargement. It is a self-reinforcing cycle that only gets harder to break the longer it runs. This is why intervening early at the first signs of progression is so much more effective than waiting until symptoms become severe. Physical inactivity is another significant accelerant. The pelvic region depends on muscular support and circulation. Men who are sedentary develop poorer pelvic floor muscle tone, reduced circulation to the prostate, and higher levels of systemic inflammation. A 20 to 30-minute walk every day, every single day, is not just good for your heart. It improves blood flow to pelvic organs, reduces inflammatory markers, and supports the kind of metabolic health that directly protects your prostate. It doesn't have to be intense, it doesn't require a gym membership or special equipment, it requires consistency. Start tomorrow morning. Pelvic floor exercises, which most people associate with women's health, are equally important for men. The muscles that surround and support the bladder and urethra respond to targeted strengthening just like any other muscles in the body. Men who practice these exercises regularly, even just 5 to 10 minutes a day, consistently report improved urinary control, reduced urgency, and fewer nighttime trips. The evidence base for this in men over 60 is strong and growing. If you are not doing these exercises, you are leaving one of the most effective conservative tools for prostate health completely unused. Let me bring this into focus with something concrete. I want you to think about what tonight could look like if you apply just a few of what we've discussed. You eat a light anti-inflammatory dinner before 7, you stop drinking fluids by 8, you avoid alcohol and caffeine after noon, you do 5 minutes of pelvic floor exercises before bed. You keep the bedroom warm and have a robe ready for any nighttime trips. You have downloaded the guide from the pinned comment, and you have a specific plan for tomorrow's meals. That is not a dramatic transformation. That is a series of small, intelligent decisions that compound. And if you do that consistently for 30 days, the cumulative effect on your sleep, your urinary symptoms, and the trajectory of your prostate health can be substantial. I want to be clear about something before we close. Everything I have described in this video is evidence-based conservative management. It is appropriate and beneficial for the vast majority of men experiencing the kinds of symptoms we have discussed, but it is not a substitute for professional medical evaluation. If you are experiencing blood in your urine, severe pain when urinating, a sudden, complete inability to urinate, fever with urinary symptoms, or if your symptoms have escalated rapidly in a short period of time, those are emergency signals. Go to the emergency room. Do not apply a dietary protocol and hope for the best. Those symptoms require urgent evaluation. If you have a known history of prostate cancer, if you are currently undergoing treatment, or if your PSA levels have been elevated or rising, every change you make, including dietary changes, should be discussed with your specialist first. Some situations require medically supervised approaches, and no general guidance should override your individual medical context. For men with mild to moderate symptoms who have not yet had a recent urological evaluation, I want to encourage you strongly to schedule one, not because these changes won't help, they will, but because knowing exactly where you stand, having a baseline PSA, a prostate volume assessment, and a proper discussion of your symptoms with a qualified physician gives you far more power to manage this intelligently. Knowledge is the foundation. These dietary and lifestyle changes are the structure you build on top of it. Now let's answer the central question directly. What is happening to your prostate while you sleep, and can you stop it starting tonight? Yes. You can stop the acceleration, you can interrupt the self-reinforcing cycle of inflammation, sleep deprivation, and further inflammation. You can begin reducing the factors that drive prostate enlargement while your body is supposed to be recovering. You cannot reverse years of changes in a single night. No one can promise you that, and anyone who does is not giving you real information. But you can change the direction. You can shift from a trajectory of worsening to a trajectory of stabilization and improvement. And that shift can begin tonight with the decisions you make in the next few hours before you go to sleep. Cut the late fluids. Skip the alcohol tonight. Take a short walk after dinner. Do a few minutes of pelvic floor work. Download the guide in the pinned comment and read the section on evening routines before bed. Wake up tomorrow with the intention of building on what you started. That is how real change happens. Not in a single dramatic gesture, but in a consistent series of small, informed, deliberate decisions made by a man who has decided he is not going to accept decline as inevitable. Your prostate is not your destiny. Your habits are. and habits can change. Starting tonight. If this video gave you something real, something you can actually use, please take a second to hit the like button and subscribe to the channel. Every week, I bring you medical information designed specifically for men over 60 who want to understand their bodies and make decisions based on real evidence, not fear, not guesswork, not marketing. Leave a comment below and tell me which of these 5 signs you recognized in yourself and what you are going to do about it tonight. I read every response and your experience matters. Take care of yourself tonight, and I will see you in the next video.